Now, for the mechanism of labor, you need to know that there are 10 mechanisms of labor. The first mechanism is descent. Is it clear? The second mechanism is flexion. The third mechanism is engagement. The fourth mechanism is internal rotation. Fifth mechanism is extension. The sixth mechanism is external rotation. The seventh mechanism is restitution. Then delivery of anterior shoulder, delivery of posterior shoulder, and expulsion. So when you are trying to have to do a labor in a patient, it must always follow this order. Is it clear? You must start with a descent. Is it clear? You have flexion, you have engagement. So you have the different elements that you have when a patient is in the labor room. So those are the different elements that you have to follow. Now, let's have an explanation of each of these elements. We need to know that let's say that this is your pelvis with a sacrum here. Then these are the ilia. The iliac, this is the rami here. Then you are going to have your pubic symphysis attaching the two rami. Then you have the ischium. This is your pubic symphysis, your two ischium like that. So provided you have this patient, now you need to know that the first diameter is as such, the obstetric conjugate or the anteroposterior diameter. In that diameter, you're going to have the head of the child is going to pass there. So let's say that this is the eye, this is the neck, and the nose, and this is the mouth. Is it clear? This is the neck. So you need to know that the biparietal diameter needs to pass through this diameter. This is called descent. You are going to have, in this case, you're going to have the descent, you are going to have the engagement. Is it clear? Now, after the biparietal diameter, you need to know that the next diameter where the child has to pass through is a transverse diameter, and then the last diameter is the diameter of the pelvic outlet. Is it clear? That's why at one stage in point, after flexion is going to help you so as to reduce the anteroposterior diameter completely. Is it clear? That's why you have flexion. Is it clear? Now, engagement is when it's going to the head is going to be entering at the level of the maternal pelvic brim. Is it clear? When the head enters at the level of maternal pelvic brim. Now, internal rotation is in such a way that because when the maternal pelvic brim passes, the biparietal diameter has already passed at the level of the obstetric conjugate or the anteroposterior diameter. Now, internal rotation like this needs to be done such that the biparietal diameter can pass through the transverse diameter. That's why you first have internal rotation. Then later on you have extension. The child now bring his head out. Is it clear? After extension, now you have external rotation. External rotation is in such a way that the shoulder can now pass through the anteroposterior diameter. Is it clear? The shoulder can pass through the anteroposterior diameter. That's why you have now external rotation. Restitution now is in such a way that the shoulder can turn in such a way that it can pass down through the transverse diameter. That's why you have restitution. Now, after restitution, now we have now delivery of the anterior shoulder, you have delivery of the posterior shoulder, you have expulsion. So when you are doing delivery of the child, you must try to turn the child in these different maneuvers by controlling the head in such a way to prevent the perineal tears. Is it clear? So when you are doing delivery of the child, you do all this mechanism. You help the child to do this mechanism. You help the child to flex. So flexion and engagement usually occur when the head is already still far. Is it clear? Flexion and engagement is usually occur when the head is still far, even internal rotation. Is it clear? This is when the head is still located at the level of the pelvic inlet. Is it clear? Now, when the child has already done extension, is it clear? You need now to control the head. Is it clear? So as from internal rotation and extension, you need to control the head. Is it clear? You do a counter pressure to the head. Is it clear? And you also do the different mechanisms to rotate the child such as to perform these different maneuvers such that the child can easily go out to prevent perineal tears. Is it clear? So those are the different elements that you have to bring out. You have to do this counter pressure. You do a counter pressure by holding the head, and then you do the different movement of the patient such as to follow this different order when you are trying to deliver a child. Is it clear? So those are the different elements. Now, if you don't do that effectively, you are now going to have perineal tear, or if you are not capable of doing extension to the child, or if the the pelvic outlet is very small, you need to do episiotomy. Is it clear? So now that's why now bring us now to this part now, still in the second stage of labor, perineal tear and episiotomy. Thank you.